Hello guys, welcome to my YouTube channel, Nursing Career. Today, I am going to explain you all about hand washing techniques. So, let us first see what is hand washing. Hand washing means cleaning one's hands with soap and water to remove microorganisms. Now, let us learn about the purpose of hand washing. First, to remove dirt and transient microorganisms from hand. Second, to reduce the risk of transmission of microorganisms to patient. Third, to reduce the risk of transmission of infectious agents to oneself. Fourth, to prevent nosocomial infection. Fifth, to reduce the risk of cross-infection among patients. Now, let us see the types of hand washing. So there are two types of hand washing. Medical hand washing, the duration is 20 seconds to 30 seconds. And surgical hand washing, duration is 40 seconds to 60 seconds. So now let us know about the 5 moments of hand hygiene. So the first moment is before touching a patient. Second moment, before a procedure. Third moment, after a procedure or body fluid exposure risk. Fourth moment, after touching a patient. Fifth moment, after touching a patient's surroundings. Now, let us see the steps of hand washing. There are 7 steps. First, put on the tap water and wet the hands in running water. Take an adequate amount of soap and rub the hands by palm to palm. Rub to back of both hands. Interlace fingers and rub hands together. Interlock fingers and rub the back of fingers of both hands. Rub base of the thumb in both hands. Rub fingertips on palm of both hands. Rub both hands till wrist. Now, rinse under running water and put off the tap with an elbow. Dry on hand, moving from finger to wrist in a rotatory motion. Repeat drying method for the other hand too. Thank you guys for watching my video. I hope it will be helpful. If you like it, let me know in the comment section below, and please do give a thumbs up and share with your friends and loved ones.